Nurses and doctors have read it. What is your "they never taught this in school" moment? Took care of a young man with a gunshot wound to the abdomen. He had many complications. He was in the hospital for over a year. He had an ostomy bag for a while, but when they finally removed it, he was so nervous because he hadn't pooped in so long. His call light goes off and he says, "Go look in the toilet. You're never going to believe this." I go in there and there's poop in the toilet. His first solid poop I had seen in over a year. I walked out and gave him the biggest hug. He was so proud of his poop. I walked out of his room with tears in my eyes. Nursing school never prepared me for crying outside of a patient's room because I was so happy they had pooped. Look, pooping is a glorious thing, and when you successfully pass that deuce, I think all of us should just celebrate in unison because it's definitely better than being constipated. Next story. How to put a fake eye back in. A patient came in from a not-so-nice nursing home with a multitude of problems, one of which was a disgusting, draining fake eye that had to be removed for treatment. Upon discharge, we had to put it back in. Simple enough, we thought, but we had no idea how and struggled to figure it out. I suppose that's why the nursing home staff never took it out to clean it. This was decades ago. Fake eye technology is probably much better today. Next story. This one was fun. Patient in ER gets a standard urine drug screen, positive for ethanol, alcohol. Patient insists he does not drink alcohol. Test is repeated, positive. Patient is very upset. He does not drink alcohol. Blood test is drawn, it's negative. We checked everything we could think of. Did we have the right urine, the right blood? It should be impossible to test positive on urine and negative on blood. Meanwhile, I finish his regular urinalysis. High white blood cell count and really high glucose. Elevated white cells mean you need to look at it under the microscope because they probably have an infection. It's loaded with yeast. The man was diabetic, obviously, and had high glucose, sugar in his urine, along with a yeast infection of the bladder. The yeast was fermenting the glucose to ethanol within his bladder. He was the man who peed beer. So, personal anecdote here, I once took an antibiotic for an infection that I had, and turns out I was highly allergic to said antibiotic, and I ended up getting a yeast infection as a result of that, and let me tell you, there are few things on earth more painful than having that going on in your system while also trying to take a leak every now and then and get that out. So yeah, totally empathize with that. That sounds miserable. Next story. When my mom was fresh out of nursing school in the 80s, she got a job at a hospital that had a high concentration of geriatric patients. One particularly frail man took out his dentures before sleeping, then passed away in the night during her shift. His cheeks were so alarmingly sunken in, my mom and another nurse tried to put them back in so as not to horrify the family. However, rigor mortis had already started to set in. She said nursing school definitely didn't prep her for that nightmare. Next story. I was in my first year out of family practice residency. The specialists like to sneeringly refer to us as jack of all trades and master of none. I was on call from an ER. A normally unshakable ER doc was beside himself. Had a very preterm mom in active labor, and fog wouldn't let us fly her out. He was the only ER doc, and the transferring facility wouldn't take her in transport without a physician on board. Probably not legal, but we needed her to be at a hospital with an NICU and L&D, so they called me. En route, I was trying to coach her breath through the contractions, but she felt something coming out. I looked and saw a foot. So we're in the back of an ambulance delivering a foot-long breech preemie. We delivered about a minute or two out of the hospital. They were expecting a mom in preterm labor, not a micro preemie. We were met in the ambulance bay by one nurse. She took a look at me holding the baby with a blanket and oxygen and said, "Follow me." We ran through the hospital to L&D and turned on an incubator. Peds wasn't in-house and the baby's heart rate was low, so I proceeded to intubate her. That was 12 years ago. She survived and is doing great. I wrote my program director at 4 a.m. that morning when I got back home, thanking him for all the training. I think I used 100% of my training that night. Next story. How to react when a patient's bowels pop out of their incision. This happened when I was a brand new nurse, but off orientation. Quite a learning experience, but came in handy because a few years later, it happened to a different patient and I knew what to do. You have to keep the bowels very moist, cover with sterile gauze, and patient is rushed to the OR. Edit. I'm glad this was taught to some of you in school. I remember learning about it, but never learning what to do if it happened to a patient. Next story. When I was a student, I accidentally degloved a patient from the elbow down. They were incredibly sick, probably already brain dead, and had one of the worst cases of TEN I've ever seen. Anyway, I'm in there holding this lady's inside out arm skin like an idiot, with the family standing in the corner horrified, and I just froze. My first thought was to kind of slide it back on, but thankfully one of the senior nurses rescued me and snipped that crap off. Next story. The first time I had to tell someone their loved one didn't make it. Though they address it, no one really tells you how to break bad news to someone, how crappy and impotent you feel doing it, the fact that you won't be able to answer their panic questions, what it's like to realize that there's nothing you can say to family members that will truly bring comfort, how shocked or even angry you'll be when some people don't really care about mom going downhill, how ashamed you might feel when you look back and realize that you're becoming numb to it all after a while. Yeah, you probably had to click through some presentation on the 5 stages of grief at some point and maybe a generic lecture on what not to say, but until you've stumbled through it a few times, you're winging it, and probably poorly. Next story. Nurse here. A very panicked nursing assistant came running up to the desk one day saying, "You have to come see this. I don't know what this is." The NA brought me into a patient's room where she was giving a bath and points to an area on the patient's buttocks. What is that? I lean in for a closer inspection when the patient starts to turn back around and says, "Is that my eye?" Sure enough, I didn't receive and report that my patient had a prosthetic eye, which at some point came out of the socket and became suction cupped to her buttock. I left the room and had never laughed so hard in my life. Yeah, this one would be hard to keep it together and not laugh. I mean, obviously it's not really that funny, but it is. It just is. Come on, you have to laugh at that. Hopefully they were able to get it back in. Next story. Respiratory therapist here. How to act when we unplug the ventilator and let go of a patient, especially when the family is around. To their defense, they do warn us if it's going to happen, but it's never until you actually do it that you realize the weight. I like to talk to my patients, even if they're already brain dead at this point, although I did have to unplug conscious patients. That was hardcore to say the least. This gives me a sense that at least if even a small part of their consciousness is still alive at this point, they know they're not alone. I tell myself that at least from now on, they won't be suffering anymore. Next story. All those things you encourage your patients to do, eat well, exercise, get enough sleep, etc., also apply to you. I know too many nurses who don't take care of themselves mentally, physically, or emotionally in a very draining environment. Self-care is incredibly important, and sometimes we'll lose sight of ourselves in trying to take care of others, but we're of no use to anyone if we're running ourselves ragged. Next story. So many things. Here's what I can think of off the top of my head. Sugar is used to put someone's prolapsed rectum back in. Sprinkle it on and let it sit, drawing some of the liquid out of the tissues of the rectum and just kind of push it back in. That was fun on the job training. How to put someone into a body bag with dignity, especially if they're tall and or in an awkward position. Fournier's gangrene. One day I was actually precepting a patient care tech when I was a nurse in the ER and had a patient ask me to help him dress his wound. This was not why he was in the hospital. Thinking this would be a great teaching moment, I called my tech in to learn how to do some wound care. She learned that day how to maintain an excellent poker face. Never block your own exit out of a room with an actively psychotic patient. How to comfort an inconsolable baby using a combination of low shushing in their ear, a somewhat aggressive swaying motion, and some humming. How to interact with patients and their family members on sometimes the worst days of their life. How to hold someone's hand when they've just gotten terrible news about their own or their loved one's prognosis. How to celebrate the, often few and far between, wonderful news we get to tell patients. And then how to leave that room where you may have just told a family their loved one is dead. Collect yourself and go into another room with another patient and care for them like it's just another day. Nursing is a profession where you have the sacred honor and ability to be there for people on the best and worst days of their life. To be able to hold a life that merely seconds old and hold the hand of someone during their last seconds on Earth. That's not something you can be taught in school. Next story. ER doc here. Sorry to intrude. They teach you how to handle death. They tell you you're going to have dead patients. You're going to see the ugly side of death that doctors and nurses don't have to see, because when they get the patient, most of the ugly is handled by you, so we need thick skin. But when you have to hold the hand of a kid less than 10 years old who says, "I don't want to die," and next watch him slide into a no waking up sleep, it's effing life-changing. F me. I didn't want to cry tonight. Enough Reddit for today. Next story. Per my girlfriend, walking into a patient's house, home health, and almost being knocked unconscious by the smell of cat piss. The lady housed 25 feral cats but didn't let them outside because she was afraid the coyotes would eat them. Walked into a trailer house connected to a camper only to see the floor start moving. Realized it was cockroaches, not the actual floor. Next story. They never really tell you how to cope with being berated by family members, patients, and even coworkers. Part of being a nurse means that you realize you're dealing with people at their most vulnerable, at the worst time in their lives, and you know this in the back of your head. But being an emotional, and sometimes physical, punching bag for days at a time requires a certain mental toughness that you can never really prepare for. Next story. What to say to a family watching you code a patient for 15 minutes and pink frothy sputum is exploding out of their ET tube while you're doing compressions. Obligatory edit. Sometimes trauma ICU nurses get short and cynical at airport bars. Shout out to the homies in the comments who explained everything already. Next story. I heard this story from a SLP. Always keep a clear exit. She was working with a stroke survivor, set her at the workspace, and walked around to the back of the table with her back against the wall and facing the door. Suddenly, the little lady says, "I know who you are. You're the lady who's been sleeping with my husband." Suddenly, this lady has lunged across the table and is legitimately trying to kill the SLP. Luckily, lots of other people came when she screamed, "Code Blue!" She couldn't think of anything else at the moment. Next story. I was never taught about sundown syndrome until I was working with the elderly in a hospital setting as a student nurse. I had the sweetest elderly patient in my care until about 4 p.m. that day. He suddenly became possessed. He started screaming and hallucinating and was not the man I had been providing care for earlier. I was so befuddled when the nurse I was shadowing told me he had sundowners and explained it to me. Next story. RN here. For me, the most surprising thing has been seeing firsthand how peaceful it is for a patient to be able to choose when and how they will die. I was present for the first medical-assisted self-unaliving on my unit. The patient had his loved ones surrounding him, and we all watched as he said goodbye and shortly after took his last breath. In my area of nursing, patients get better and go home. I always viewed my work as a means to make people better. It's taken me a while to process his decision. It was beautiful and peaceful and really made me look at nursing in a different way. I care for people to help them live, but for this man, I was able to support him through death. Next story. Number 1, most memorable. Cardiac massage for 10 straight minutes while a guy was bleeding to death from multiple gunshot wounds. Had to stick my fist up through someone's left lung to locate the heart and to directly give them CPR, literally pumping this dude's heart so it can keep circulating blood. Felt like I was doing a fatality move in Mortal Kombat. It was surprisingly small and very squishy. They never teach you to expect the unexpected. I got floated to the ICU on a slow day. They immediately gave me a patient who was violently hemorrhaging out of his mouth while all of his family was inside freaking out with me. He died an hour later. Had 2 different patients come in with these big kitchen knives deeply embedded in an eye socket. They were both awake and talking. Enema parties are a thing. Inflatable chicken implant surgery is pretty shocking but also amazing. Opening up a tumor/cyst to find fully grown teeth and hair inside of it. The day a patient exploded in surgery and it splattered the entire OR room with this brown fluid. There's an alarming number of nurses and doctors who don't know what the F they're doing. I've learned so much more, but those are what I can immediately recall. Yeah, that's definitely the underbelly of working in a hospital. Some of those stories I could have gone my whole life without knowing. That is gross, gross. Glad you're doing it so that we don't have to. Next story. Patients having sex and or shooting up in the bathrooms. People coming in OD'd and then bouncing out the door as soon as they're conscious to come in OD'd again a day or two later. Then repeating the cycle every week or two, but somehow never dying. Patients who fake symptoms to get admitted for attention or to get a day off work or get hopped up on goofballs or whatever thing they're after. Delirious old ladies telling me to get out of their living room or they'll shoot me. Patients coming in next to dead because they've been neglected in the prison system. Next story. If you have a patient in labor or in any painful procedure who wants to hold your hand, only let them hold 2 fingers. They can't squeeze them too hard and break the bones. They still get the comfort of human touch. I've had patients in labor pinch me, pull my clothes, and squeeze my 2 fingers as hard as possible. Some are just panic, but some seem to be angry and want to hurt someone. I calmly ask them to stop with the pinching or pulling on my clothes because that isn't helping them. These are often people who have refused an epidural because they're afraid of needles, and I understand that. I'm just not going to be black and blue. I always teach the new nurses or students the 2-finger trick. This reminds me, several years back, I had a couple in for delivery. asked what method of pain control they preferred. They looked at each other, giggled, and said, "She bites me." I asked for clarification, and apparently during her first 2 deliveries, when the contraction pain became unbearable, she would take his hand and literally bite the effing crap out of his knuckle. They were both hip to this plan and oddly proud of it. Fast forward a couple hours and labor is getting well advanced. I look up from a vaginal exam in time to see her clamp her teeth on his callous knuckle. She appeared to be biting with full pressure. He made a bit of a face but not a sound. And thus we ushered their youngest into the world. Contraction would start. She'd take a lung full of air and push to the count of 10 while biting the hell out of her man. It worked for them, so who am I to judge, but it made me somewhat uncomfortable. Hey, I mean, like you said, it worked for them. It has worked for them with other children and stuff like that, so yeah, let him live. If he's okay with it, go for it. Next story. They never teach nurses how to express or manage expressions in unexpected or poor situations. I personally have no trouble finding anything, but watching people around me and the people, patients themselves, tend to ask me what's wrong with that nurse or doctor. Me being able to keep such a straight and relaxed face and expression helps everyone around normally. Being able to explain something bad without a panicked expression is an invaluable skill, which can definitely be learnt and taught. Though nothing can prepare you for some situations, I can say I can't remain relaxed with a high-risk person self-remove a trach tube. Next story. Obligatory, not my story, but my grandmother's. My grandmother was a school nurse at an elementary school. They were letting the kids out for the day, and all the kids were waiting outside for the day. One little boy's mom came to pick him up. As she was walking up to the building, she began to have a heart attack. My grandmother began CPR, sent someone to get the defibrillator, and told another teacher to call 911 as you're supposed to do. She passed before 911 arrived. I don't think twice her time in medical school could have prepared her for that. Next story. My mother was a nurse who cared for elderly patients in a very rural part of England. Here's a few of her favorite stories. One was a lady who decided to help clean the windows. She used the food from her dinner as soap and napkins. That was a fun mess to clean up. Another was 3 gentlemen who spent the night calling out for their wives. One was named Edie, one was named Emma, the other was named Elspeth. She said that was one of the longest shifts ever. Finally, she said most of the elderly men were completely useless when it came to ordering their dinners. They would always say something along the lines of, "That's my wife's job." She used to just order them the basic meat and 2 veg option and rarely got complaints. Whatever your granddad would like usually was the safest bet. My grandfather was a farmer. Next story. When your patient has a crap the size and shape of a football stuck in their butt, and you have to use your finger to delicately scoop it out. When the doctor comes along and tells your patient they're dying of cancer, then walks away and leaves you to pick up the pieces. When your patient is 90 years old, has dementia, diabetes, cancer, and comes to hospital with pneumonia, they're 30 kg soaking wet, nothing but a bag of bones who doesn't recognize themselves in the mirror. Yet their family insists they're for CPR. Next story. As a sonographer, I have to keep a poker face a lot of times when I'm seeing something very alarming or sad on the screen. Luckily, most people have no idea what I'm looking at, so that's a plus. I'm not allowed to give any results to patients. Doctors deliver the bad news, so I have to stay neutral. It's very hard. Next story. I had a 60-something-year-old female patient show up for a same-day appointment to establish care from out of state. No medical records, denies any major medical history or medications. Never smoked, drank, or did drugs. Midway through the exam, she starts telling me that she's seeing evil lines all over her house. States she's unable to cross these lines and thus unable to access parts of her house, e.g. her bathroom. She hears voices coming through the walls, feels shadows at night or demons, thinks the neighbors are hexing her all the time, starts talking about the occult and Freemasons ruling the world, suddenly stops mid-sentence, stares at me without blinking, and wants to know if I could perform an exorcism. Sorry, missed that section in medical school. Next story. Harassed by an elderly patient. The guy is 80 and frail. Was I grossed out? Yes. Was I threatened? No. But they don't teach us how to respond to impotent harassment from hospitalized patients. Do I get a new doctor for him? What if that doctor is a woman too? Should I put up with it? I treat rude, abusive a-holes every day. Why would this be any different? Still trying to figure out what I should do. Next story. So many things. I'd say the chief thing we're not prepared for is just how cruel, bullying, and inhumane our own colleagues can be, not just to each other, but to patients and families. We're absolutely not taught how to handle the stress of our jobs, not given tools to deal with that one raging a-hole coworker who just doesn't pull their weight, and not taught how to de-escalate a family that's been antagonized by an overstressed, burned-out nurse, physician, aide, tech, etc. I've worked as an EMT, a tech, and now as an RN, and I can say without fail that more stress in my job comes from baloney from coworkers than anything else. Maybe I work in the wrong hospital. Next story. As a student nurse, I observed a cesarean DT preeclampsia. Lady is awake with epidural in place and a screen in front of her. All went well, nothing dramatic there. Uterus sewn back up, and I was starting to relax and look around when the surgeon asked the med student at the foot of the bed to step aside. He then reached in and pumped the uterus twice and hard, forcing the remaining afterproducts out her privates fast. The wall wasn't that far from the foot of the bed, and that student had definitely been in the line of fire. The PT didn't notice, and the husband didn't seem to. The med student and I looked at each other. She just said, "I guess that's logical enough." Dunno how standard that is. Haven't been back to the OR, but I sure wasn't ready for it. Next story. That you will get yelled at by a doctor, patient, fellow nurse, charge nurse, etc. for something that was not your fault. The first time I was yelled at was about not calling a morning lab that wasn't a critical result. It was hard not to take it personally, and I did need a minute to recover. Since then, I take criticism better, but sometimes we all yell, especially in high-stress situations, and sometimes people are jerks. Next story. Long story short, a resident at nursing home had hemorrhoids. They were noted to be bleeding at the beginning of my shift. Stated to my CNAs to notify me when they change her so I can scale the amount. Orders for the medicine was sent in. Nothing from the CNAs. Resident was fine when I check on her. Pass on info to next shift and go home. Get called to the office the next day to be yelled at about it. I followed protocol and charted accurately. Medicine is not available at this time, none in backup. So they then tell me why I didn't put an ice cube in her. An ice cube? I exclaim. Yes, they say. Didn't you learn that in school? No. We have to have orders from a doctor for a cold pack, let alone put an ice cube where the sun doesn't shine. Next story. Paramedic here. They don't give you a class on telling families bad news, such as in the death of a loved one. I found over the years, if you come out and say so, and so is dead, literally using the word dead, people understand it better. It's brutally honest and not beating around the bush. I don't use passed on or in a better place. I'm not a religious person or even remotely spiritual, so I don't say religious crap. It's not place to do that, and I just give them the facts. Next story. Doc here, infant, 2 months, came in unresponsive. Despite our best efforts, there was nothing we could do. In that situation, we have to assume the worst despite the mother's story, and the baby must be examined and sometimes scanned to check for evidence of abuse. Had to wing it as I took a dead infant from the hysterical and extremely upset mother shouting at me in a language I didn't understand. To this day, I'll never forget those screams of pain. Parents, please don't let your infant sleep in the bed with you. Next story. Had a patient with horrendous teeth, meth user. Couple of teeth fell out during intubation, so they sent him up with them in a denture cup. That was a real awkward conversation when he woke up. Anytime there's something up the butt. That time a 100-year-old grandma broke her hip falling out of bed, but not her bed. On a more serious note, the "your loved one is dead" phone calls. This is usually done by the doctors, as I feel it should be, but sometimes nurses do it. Next story. Not a nurse or doctor, but I'll never forget the comment my labor and delivery nurse made. Had been laboring in the tub at the hospital, but wasn't supposed to actually birth in it, when all of a sudden I could feel the baby coming. My husband pulled the emergency cord and the nurses rushed in. Through a haze of baby-crowning pain, I heard a panicked nurse say, "I don't know what to do. What do we do?" I distinctly remember laughing to myself and heard my midwife's calm voice say, "It's okay, I've got it," as she moved past the nurse and took over. Next story. My daughter had a mucus cyst in her lip. Hideous thing. Gigantic and throbbing and horribly embarrassing for her. When it didn't go away after a week or so, she went to our doctor, who happened to have a posse of residents under him that week. They all came in to pike it and learn about it. She just got it removed today, and there were 6 extra doctors in there watching it all go down. It's basically a blocked saliva gland, full of lip snot, and it was a very exciting experience for everyone except her. Poor girl. LOL. Next story. Some people talk while under anesthesia. Some people even scream. I used to go home in tears, especially after very vocal patients. The only thing that helped was when patients would wake up and tell us, "Thank you so much. That went so fast." Post-op checks a week later where I could see the patients were still okay helped too. I remember asking the doctor over and over when I first started, "Are you sure they're under? Are you sure they're numb?" Now, after a few years' experience, I understand how much local anesthetic he used and that patients were likely numb for a few hours post-treatment. Dental assistant who worked for an oral surgeon. Next story. If you want to take away anything from this thread, it's take a CPR class, learn basic first aid. Google and learn about living will, advanced directive, and DNR. Talk now to your loved ones about what you want to happen when you're no longer about to care for yourself / kept alive via machines or able to make decisions. And please know that people in the medical community are overworked, underpaid, miss their families, probably have to pee, and are here for you and your family. Please take the time to research and vote on bills that affect healthcare, EMS, hospitals, and first responders. They will affect you too. Next story. As a nurse's aide, we're just supposed to say, "I'll get the nurse for you," when you get a real stumper. But when a dying patient or their family member cries to you that they don't want to die, you can't get someone else to help them. You have to find the exact words to find in the middle of serving dinner and 5 call bells ringing off your hip. Probably the hardest situation in palliative work. Next story. One of my favorite stories to tell is how you get lulled by the complaint in the chart. Earache is 10 million ear infections and the occasional cockroach. So the complaint is rectal pain. I immediately think hemorrhoid, perirectal abscess, or a fissure. So I see Mr. Rectal Pain. Gentleman tells me he has rectal pain and literally no other symptoms. I get to the part of examining his anus and there's a normal looking anus. So, we should do a rectal exam. I digitally examined his rectum and instantly say, "Ow, there's something sharp in there." Out comes a fishbone. It was big too, like a 2 to 3 centimeter fishbone. I asked the patient about it and he's like, "Oh, I had red snapper a few nights ago." In the specimen cup it goes, and me parading through the emergency department showing everyone what I just fished out of some guy's a-hole. I crap you not. I tell this story to my colleague and he proceeded to tell me how in his residency they did rectals on all trauma patients. One time, one of his fellow residents goes to do a rectal on a trauma patient and said the same phrase, "Ow, there's something sharp in there." Instead of a fishbone, it was a hypodermic needle. Next story. What to do if a gang member comes into your ward and shoots your patient who's a rival gang member. That was a nightmare. 4 shots at point-blank range, and even then, one of the bullets hit the overbed table instead. It freaked me out that you could still hear the bullet rattling around inside it whenever you moved it. I quit nursing soon after and went into IT instead. Next story. Was following a nurse for a day as a medical student. When the nurse left, while this old dude was bathing, he retracts his foreskin to reveal Charlie's Cheese Factory and asked if I could clean it. I told him I ain't qualified, and when the nurse returned, I told her he probably had yeast infection in his chicken and he started backpedaling. Next story. One of my coworkers' patients was altered mentally and got physically abusive frequently. Like, whenever the call bell went off, everyone went running. Well, the alarm rang and I ran into the room and tried to get in between my coworker and the patient, who was hitting her repeatedly. When I approached, he reached into his diaper and slammed a handful of poop onto my head and face. You don't learn how to deal with mental warfare in nursing school. Next story. I went on a ride along with my instructor right before my class was finished when I was getting my EMT. The service he worked for ran a single medic in a SUV so they could get there quick, and then they called for a BLS rig to transport. Well, we got called to a cardiac arrest, and there wasn't a BLS rig available, so they had to send one from the next zone over, about 20 minutes away. So here I am, barely out of EMT school, and I'm responsible for compressions, intubating, shocking, and ventilating this guy while my instructor is pushing meds. We worked him for 20 minutes before aid came, and about another 20 before we called it. By this time, we had a Lucas on him, so I somehow got elected to be the one that continued to bag him while the family all gathered around to pray and say goodbye. Then I finally turned off the Lucas and it was over. Next story. Not nearly as extreme as some, but it weirds me out every time. But people with dementia sometimes forget some or all of their own family members, and also forget common social decorum. I can't go a week, and it never gets any easier, but one of these patients will openly talk about the sexual attractiveness of an adult grandchild. But let me backtrack. By the time the patients are with us, the family realizes that the end is near. So a lot of people that weren't always present in the patient's life start showing up, and obviously the patient has deteriorated since their last visit. Sometimes, after the shock disappears to the family members, I don't know how to say it, but they're essentially seeing this person or patient as a normal person. The grandpa, grandma, mom, dad, whatever they are, part of their life is gone. The patient kind of becomes their true, unfiltered self in a way. Some families get the fortune of kind of getting to see this person as how their friends see them, but it almost always gets down to the patient getting rather sexual in their conversation, and sometimes a younger, attractive family member is essentially hit on. Some people take it in stride and understand the situation, but there are times, oddly, it usually is the guys, who lose it when they find out grandma wants to ride on him. Next story. Patients with no hope of recovery in the ICU. It's difficult from a resident standpoint, as I don't want to see these people suffer indefinitely, because I know that I would not want that for myself. Regardless, I would say that most families are full court press in resuscitation, even though it won't change anything long term. Every time these patients pass, people are either grieving or grateful that their loved one is no longer suffering. What they don't teach you in med school is that people are people. It's their dad dying, and they won't be the one to say let them go, no matter how bad the pathology, and that's not their fault. I never realized in school how important goals of life conversations would be. It's an art and a very important part of critical care and machine in general. Next story. Labor and delivery are in here. They never taught me how to comfort a patient who was 22 weeks pregnant with an infant that had expired 1 week prior and had already begun the process of decay inside the mom. The infant was breech, but mom had multiple vaginal deliveries before, so the decision was made to attempt vaginal delivery. During the pushing, mom had delivered the body and shoulders, but the cervix quickly clamped down before delivery of the head. The combination of the resident pulling the infant's body with just a little too much force and the present breakdown of tissues due to decomp caused the baby to be decapitated. Nothing in this world could prepare me for that. I looked up and saw the look on the dad's face, and all I could do was try to keep his gaze locked on me and my eyes and repeat, just focus on me, just focus on me. Worst day of my life. Honestly, I don't know how I showed back up to work for my next shift. The doctors took the patient back to the OR to perform a D&C for removal of the infant's head from her uterus. It was a horrible, horrible experience for everyone involved. Next story. I did chest compressions on a daughter's obese mother while she stood at the head of the bed pleading I save her life. I've had BLS training since I was 16, but using it so often in a hospital setting makes you less empathetic. I'm also a male nurse, if it makes any difference. However, I didn't expect not to get the feels after such a critical moment in a family's life. My mother survived. I definitely broke most of the bones in her chest. Next story. Nursing school did not prepare me for aged psych. Daily incident reports due to being hit, kicked, punched, slapped, yelled at, and propositioned. It was considered a good day if your patients only yelled at you. It was emotionally draining as much as it was physically. I fell pregnant and left. Wasn't risking getting hit and hurting the baby. Went back to aged care. Another thing they don't teach in school is the sick sense of humor you and your colleagues develop to help deal with everything. Next story. How to take prosthetic legs off when the patient is either dead or unconscious. Removal of foreign bodies from rectums. Yes, that means exactly what you think it does. What coins look like when they're swallowed, and what to do when the IV drug using patient requests to start his own IV. How to digitally stimulate a bowel movement in a paralyzed patient. How to apply a cervical collar on a trauma patient. Next story. CNA here. I know I might not fit the bill, but I'm telling my story anyways, a healthcare worker. Sometimes even when you do everything you're told and do the job right, crap happens. You're going to have an elderly patient you know will fall, but there's little you can do about it other than lessen the damage. There's going to be a patient family member you get a little too close to and will feel hurt when they blame you for something. You will trust your superiors and possibly get thrown under the bus for it. I had an instance where I had a new patient in my assignment who arrived on my day off. The nurse gave me a very quick report about him and was told that although he would be a little resistant, he wasn't combative and he was purposefully placed with me because I was a pretty calm CNA and chatted with my patient, so they were all pretty comfortable with me. We were short-staffed, as always, supposed to have 9 to 10 for second shift, and I think we had 5 that afternoon for all about 115 beds. I had another CNA assisting me with this gentleman to transfer him, but he had to leave to get an O2 canister. Never made it back. My patient got a little restless as we were waiting. I couldn't move him in his wheelchair as he was hooked up to a mounted O2, and I also couldn't leave him alone. Yada yada. I wind up getting punched in the eye while calmly waiting and chatting with my patient with no warning. My glasses broke and I was stunned. Pulled the call light. Nothing. Looked out the door, but there was nobody there. I wound up using a phone to call the front desk and beg the nurse to come down because he hit me and I didn't want to be there alone. It still took her 15 minutes. Went to the doctor after continued issues. Concussion, minor cartilage break in my nose, black eye, and vision issues. It's been a few months now, and I've lost my central vision in that eye and have started getting spots and floaters in the opposite eye. They're going to probably take my license soon. Seen several doctors and specialists who are at a loss, and I don't think they can do anything. Severe macular puckering with scarring. I've been told surgery wouldn't do anything because the rods and cones are pretty much dead there. Plus, I have migraines daily now. I wanted to go to school to be a nurse. I take care of my husband while he waits for a disability decision. I'm not even 30, was working 60 hours at a job I loved, helping people, and got injured. Protect yourself. Little things can change your entire life. Next story. I work in Geri Psych. I'm a brand new baby nurse with all of a year and a half of experience. So in my first month back, I'm sitting at the nurse's station charting one of my favorite residents, rolls up calmly, lifts his shirt, snatches his G-tube out, and with this crap-eating grin, flings it across the desk and hollers, "Catch!" Next story. Putting in a urinary catheter in a patient with a fistula, opening between where poop and pee comes in. I was like fresh, 5 weeks out of school. Put in urinary catheter and poop comes out of it. Luckily, the guy was kind of out of it and there was no family in the room because I let out the loudest, "Welp!" Next story. I'm a nurse. I was orientating and a code was called. I entered the room and helped with CPR. What they don't teach you is how it's going to feel. Pushing on the chest and feeling everything mush as the bones break. Each compression causing the patient to release a small amount of air through the vocal cords. They don't teach you how it feels to be compressing someone's chest and have them stare at you lifeless. They don't teach you how everyone can be going 110% as soon as that time of death is called. The room empties all of the additional staff. It's a real sobering feeling. Also, PSA. Always carry some form of identification on you with an emergency contact phone number and name. It saves a lot of time in notifying appropriate family and next of kin in case of an emergency. Next story. Outback Australia. After hours, hundreds of kilometers from any town and maybe 700 to 1,000 to any decent-sized place, sometimes with a local health worker, but often just alone with a Toyota Land Cruiser as an ambulance. I received various places around the north of Queensland. Called to a high-speed car rollover way out in the desert. Driving for 2 hours on unsealed tracks and came across a crumpled car. 4 dead, but couldn't find one of the heads. Searched for ages until it was found. Felt really weird carrying just a head. Called out to a suspected self-unaliving at the edge of a dense tropical forest. On arrival, shining a torch and could see a figure in a tree. To my horror, the figure was moving and twitching. I charged in, planning to cut the person down. When I got much closer, I could see the body was covered in ants and creepy crawlies, etc., and that it made it look like he was moving. He had been missing for a day. Delivered a live baby one night. The lady's water had not broken, and the little guy was born inside an intact membrane. Now, this is taught in school, but I must have forgot, not paying attention or whatever. Found out later, it's believed to be a lucky child and often become fishermen because the rumor goes they never drown. A guy was dragged into the clinic one day who had almost complete degloving of his leg from the thigh down. With the skin gone, you could see the muscles moving around, like a sort of live anatomy book. After a long recess on a beach, on a tiny island, the rescue chopper arrived and scooped the young boy. They took off and at about 50 meters altitude began descending. I thought there was a problem, so I jumped up and tried to clear the bystanders away. The chopper hovered for a few seconds. Somebody waved and then they flew off. Found out later they thought I had collapsed and were worried I needed medical attention. I'm old, and after they took off, I just had to lay on the beach absolutely knackered. Lots of bad stuff, but an awful lot of really, really good memories. Happily retired now. Next story. Training really emphasizes procedures, things we do to patients. We're expected to be good at them and want to be good at them. What we're not taught is that we may well find that this isn't what makes your day. I've delivered hundreds of babies, responded to codes, attended patients in the ED and ICU. It's all very exciting and gratifying when it's not terrifying. OTOH, what gives me a sense of satisfaction is treating depression, chronic heart and lung disease, and helping patients deal with cancer. I guess I just feel better about helping someone breathe or feel better in their lives without doing invasive things to them. Seeing someone smile for the first time in months makes the whole day worthwhile. Next story. My sister's a respiratory therapist, and on her shift in the ER, a trauma came in and was coding. I'm not sure the full detail of the story and how it happened exactly, other than the person was in a horrible car crash and his lungs were filling with blood. They had to cut open his chest to start compressions, and my sister had to hold his beating heart out of the way. She said it was amazing, but not something they truly prepare you for. Unfortunately, the person died. Next story. How to have honest and vulnerable conversations with the dying and their families regarding their impending death. The scenarios vary depending on whether or not it's been a long illness or something is suddenly happening that they likely won't survive. Then, turning off the emotions that those moments elicit. The range of emotions from patients, families, and treatment team is wide as well. I've cried in the break room, in my car, in the hallway, at the bedside, then pulled myself together to get the person next door their turkey sandwich and warm blanket that they've been calling for. Next story. From a reverse perspective, I was admitted to the hospital at 19 for a DVT almost the size of a golf ball in my right leg. My nurse said something along the lines of, "I've seen some Commodin patients, but never one as young as you, and never one so small and sick." I was 115 pounds, 5'8" at the time, and my right leg was swollen to twice the size. I don't think my nurse nor the Kautman clinic at our hospital was prepared for younger blood clot patients. The head doctor at the clinic reminded me almost every week that I was the youngest Commodin patient the hospital had, having just turned 19 a month before. Also, my family tends to entertain the ER with emergencies nobody expects. One time, I gave myself a concussion and whiplash on a ceiling fan, which I broke on my skull, knocked myself out for like 30 seconds, and had migraines non-stop for 8 days. Surprise, ER! So many people in the ER kept stopping by to ask me my story and laugh about it like, now I've seen everything. Next story. Nurse here. They don't teach you how to maintain honesty when your doctor skirts around a cancer diagnosis. I've had a few cases where a physician avoids patients' and families' questions and tells them to wait and see what pathology shows. The doctor will spend 30 seconds in the room giving vague information and leaving me to pick up the pieces. Patients often ask, in your opinion, what is most often? What did it mean when the doctor said this? And my response is almost always, when it presents like this, it's usually a cancer. I then spend the next 30 minutes educating the patient and offering resources on what the next steps would be. Next story. I'm a home hospice nurse. In nursing school, we learned surprisingly little about the dying process, stages of grief, had a hospice clinical day. But nothing in the world has prepared me for the things I've seen. How most people die is not like in the movies or TV. I've seen many vomit through their noses and take their final breath, or when you roll over a body that had liver issues, put a chuck under their face because you'll likely have a bloody mess coming out of their face. Dying can be just as messy and hard as birth. We call it birthing a soul. It's different for every person. Next story. My twin sister is a nurse, and she most definitely didn't learn how to care for her own dying mother in nursing college. Our mother died from cancer, and we nursed her until the very end at home. I was very thankful that my sister is a nurse and knew what to do. But the minute my mom passed away, my sister could not be in the same room. She had already seen so much tragedy as a nurse before, but nothing could prepare her for her own mother's death. I think my sister questioned her choice of being a nurse after that. To me, I was seeing my mom passing away, and finally being released from all the pain she was feeling. For my sister, she knew what was happening below the surface. She knew how my mom's lungs were giving in, and her heart was failing. The thought that she knew killed me inside as much as my mom dying did. I have a lot of love and respect for my sister. Next story. We were taught this in school, but never thought we'd get to see it. Multiple organs. A cadaver we worked on had 2 full-size and multiple smaller livers. One of the full-size ones was just around the heart, so while I was doing my guided incision and got a liver out instead of a heart, the prof was like, how bad can you be to get liver from a heart hole? Next story. There's a black market for Imodium. Opiate users like to take it in large quantities to prevent withdrawals. I once had a guy come in after overdosing on it. Thankfully, bowel function returned. They also don't teach you that it's okay to cry or shed a tear with patients or families. Yes, they teach you empathy, but it's okay to show your pain also. Keep strict records of CBI, continuous bladder irrigation, input and output volumes. I once inherited a patient who was undergoing CBI and started deteriorating with progressive abdominal pain. Bladder had perforated and they were irrigating her stomach. Never overlook a psych patient. Had a RR in the psych ward as a resident, heroin user with psychosis, screaming and yelling. We thought she was going through withdrawals initially, I think. She coded. We resuscitated her and later found her stomach had perforated at some point. Also, that there isn't really a true volume at which you should straight cath a patient as needed. Lord knows when I get up in the morning, I can put out what feels like a liter sometimes. Can't think of any more right now, but there have been a lot. Next story. I'm still a pretty new nurse, but I was a psych nurse for nearly 2 years, and honestly, we learned very little about psych in school. The clinicals were basically useless. So there is a lot I had to learn as I went, like how to stay calm when you're cutting a pillowcase off someone's neck that they tried to unalive themselves with, or how to deal with a psychotic teenager who's bigger than you punching holes in the drywall and then using the pieces as a weapon, or what to do when you walk into the dark day room at 3 a.m. to find your patient perched up on top of the giant TV near the ceiling like he's schizophrenic Batman. I miss psych, honestly. It can make med-surg seem so boring sometimes.